Hello everyone, I Dr. Shamsher Singh welcome you all to my SSB Pharma Learning channel. Today I am going to discuss about a very useful topic, that is arrhythmia and various type of arrhythmia. So in this lecture I will discuss with you that what are the cause of arrhythmia and how you can analyze the arrhythmia process from the ECG and what is the correlation of arrhythmia with the other drugs. So basically you know that the first thing is called as rhythm. So rhythm, it is the process by which there is a heart show contraction and relaxation in a normal process. So that means in a rhythmic process. So basically you know that whenever you will see PQRST interval, this PQRST interval is consisted of these points, that is PQRST. So this PQRST indicate your cardiac output, that is the process where your heart contract. Now this cardiac cycle, it is consisted of zero point 0.8 second. So that this total interval of the rhythmic process, which is called as a rhythm, is consisted of total 0.8 second, which you divide in 0.4 second, 0.3 second and 0.1 second. So this is called as a cardiac cycle. So basically you know that similarly you will appear these all things on the ECG. Whenever you will see ECG strip, there are large boxes, that is 5 multiplied by 5, 25 boxes. Each large box contains small 5 by 5, 25 boxes. So that means each large box consisted of PQRST, that is one cardiac cycle. So it means you can understand that if I separate each large box which contain a small 25 boxes, that is 5 multiplied by 5, it contain a 1 PQRST intervals. So this R wave, which is an indication of your ventricular contraction, this P wave indicate your auricular contraction, and your T wave indicate your ventricular repolarization. Now see here, whenever you see the normal physiology of the heart, in case of normal physiology, you know that heart is consisted of a 4 chambers that are called as 2 auricles and 2 ventricles. Now basically whenever you see, this is a left auricle, this is a right auricle, this is a left ventricle, this is a right ventricle. Now this left side contain oxygenated blood and this contain deoxygenated blood, right side. Now in this right auricle here, there is a SA node which is called as a sino-auricular node. It means sinus rhythm is there. There are two type of fiber which are present in the SA node. One is called as a rhythmic fiber, another is called as a autorhythmic fiber. Now this convey the impulses toward AV node, that is called as auriculoventricular node, and from AV node the bundle of His and Purkinje fiber, these carries impulses toward the ventricles for the contraction. Now this process of transfer of impulse from SA node to AV node and from AV node to bundle of His and from bundle of His to Purkinje fiber, this is called as a rhythmic contraction. Now, but whenever you know that there is a loss of rhythm, whenever the rhythm is lost or whenever the contraction or relaxation time is abnormal, because I can show you here how it can become abnormal. So basically you know that whenever you will know the intensity of contraction, so heart contraction, so there is a presence of leak type of the sodium channel. So basically this phase is due to the increased entry of sodium, and this is due to potassium, this is due to calcium, this is due to potassium and calcium. Again there is a calcium. Now see here, whenever you will give any drug which will affect the normal rhythm, either they are sodium channel blocker, either they are potassium channel blocker, or either they are potassium or calcium channel blockers. So basically these type of the drug whenever you use, they interfere with the normal entry of sodium, they interfere with the normal entry of potassium, and they interfere with the normal entry of the calcium. These type of the things, first thing that is called as a ionic dependent depolarization repolarization process is altered by some drug. This is one of the cause of arrhythmia. Now what are the different type of arrhythmias? If you see here, arrhythmic defects, that is enhanced ectopic pacemaker activity. That is ectopic mean this is the superficial SA node associated after depolarization, re-entry, extrasystole, proximal supraventricular tachycardia, atrial flutter, atrial fibrillation, ventricular tachycardia, torsade D point, ventricular fibrillation, and atrioventricular block. So these are the type of arrhythmia which you will see. These are the different type of the arrhythmia. So today I will discuss with you. So you should like and watch whole of the video so you can understand the process that what happen in the arrhythmia actually. So in this case, you know that it is the improper beating of the heart. Now, why it is improper beating? Because either this is due to the interference of this particular transfer of this wave of contraction from SA node to AV node, either they are abnormal, and from AV node to bundle of his, either they are blocked or they are, not properly transferred, and either from bundle of his to Purkinje fiber. This is one of the reason. Another reason can be altered sympathetic and parasympathetic activity. You know that our sympathetic system increase the heart rate. Like you know that whenever you are in stress, there is a increase in the level of adrenaline in the body. That is, these are the catecholamines, that is the adrenoamines. The level is increased. Increased level of adrenaline activate adrenergic receptors which are called as alpha and beta. And you know that alpha receptor are present on the blood vessels, basically on the smooth muscle, and beta they are present on the adipose tissue, they are present on the aorta, they are present on the lungs and many other part of the body. So basically due to activation of these receptor, on the one side they cause blood vessel constriction, so they increase the preload over the heart. This is the one effect. And the second effect, they increase the SA node conductivity because of the presence of beta 1 receptor. So due to this presence of CAMP dependent, GPCR dependent beta 1 receptor, there is an increase in the SA node activity which can abnormally transfer the impulses from SA node to AV node and from AV node to further toward the walls of the ventricle. This is the second cause. The third cause can be if the patient is suffering from hyper or hypothyroidism. Either the patient is suffering from hyperthyroidism or is suffering from hypothyroidism. Next, the fourth point which is responsible for the arrhythmia, because this is the major cause of death. It can be due to, that heart attack, it can be due to myocardial infarction, or it can be due to increased consumption of tobacco, which contain a nicotine and nicotine through nicotinic receptor increase the heart rate. So basically this is the thing I have discussed with you, because the condition is called, there are two type of the condition I will tell you. One is called as a bradyarrhythmia or bradycardia. Another is called as a tachycardia or tachyarrhythmia. So I will tell you, brady indicate whenever there is a term bradycardia, the bradycardia term indicates decrease in the heart rate. So how much it is decreased? From 50 to 60 beats per minute. So this is called as a bradycardia. Now another term is called as a tachycardia. Now tachycardia means whenever your heart rate is increased than 100 beats per minute. Now another thing is called as bradyarrhythmia. That is arrhythmia which is responsible for decreasing the heart rate, and the term is called as tachyarrhythmia. Whenever there is increase in the heart rate, this is called as a tachyarrhythmia, increase in the rhythmic contraction. Now, in this case of tachyarrhythmia, from PQRST interval, the R wave repetition is increased. So basically the R wave lies around 80 per minute repetition on the PQRST interval. But whenever it is above than 100, it also indicates tachyarrhythmia. And whenever the R wave repetition is low than 55 or 60, it indicates bradycardia. Increase R wave indicate tachycardia. So basically these are the things you should know. Now this is the interval, you know that refractory period. So what is refractory period? It is a effective refractory period which is the minimum interval between two propagating action potentials. So what does it mean? If I will show you here structurally, suppose this is a one contraction of the phase. This is a first phase of contraction. Now this goes down due to opening of your potassium channel and increase, sustained increase in the leak sodium channel. Now, if this time is increased, that means if the in between difference between the two wave of contraction is increased, then you know that there is a increase interval here. So if it is decreased, it means the potassium channels are open for a short time. Now this is the one of the action potential. You know that this is the resting potential and this is the activating potential, and it goes toward the plus 30 side, that is the increased potential in millivolt. Now this is the effective refractory potential. Now arrhythmia defects, what are the various type of arrhythmia defects? The first defect is ectopic foci. So this is abnormal pacemaker site. So you know that in case of ectopic foci, you know that we also insert artificial pacemaker. तो कई अब many time we says that हम कहते हैं कि हम तो अभी artificial एक हम ऐसे नोड डलवाई है जिसको हम पेस मेकर कहते हैं, स्टंट कहते हैं, that is for the opening of any closing vessel. Now this in case of SA node, this is a pacemaker which is required whenever your SA node is abnormally producing the waves. जब आपकी SA node क्या करती है, from SA node to AB node आपका जो impulse generation है that is abnormal, उस केस में हमें ectopic foci को क्या करना पड़ता है, there is a need to treat such type of the situation. So next is called as after depolarization. So after depolarization is of two type. One is called as early after depolarization. So what does it mean? अगर हम बोले कि early after depolarization, तो ये जो phase है, this is phase early after. Early means पहले. So it means this is the second phase which is originated, which is called as a early after depolarization. Now this early after depolarization, this is the another cycle where it doesn't go toward the refractory side, toward the relaxation. Again it is early after depolarization. This is the major problem for the torsade D point. This is the major problem. So early after depolarization, whenever you know that कि अगर आपका हार्ट कंटिन्यूसली कंट्रैक्ट करता है विदाउट एनी रिलैक्सेशन, तो रिलैक्स नहीं होता, बिकॉज रिलैक्सेशन इज ड्यू टू ओपनिंग ऑफ पोटाशियम चैनल. सो इन दिस केस the most problem from where the population suffering is torsade D point. Now, it is the early after depolarization. Another thing is called as delayed after depolarization. You know this from this side. So this is the action potential curve, and this is the another curve which is the another wave of contraction initiated. This is called as a early after depolarization. Now this is called as a delayed after depolarization. So this early after depolarization can be due to excessive intake of CNS stimulant like tobacco, nicotine, cocaine, like other things, or it can be due to the hypersympathetic tone. So this is the early, this is a delayed after depolarization. So this delayed after depolarization, what does it mean? It means the action potential will be originated after a time, after a gap, which is called as a delayed. This generally results from calcium overload, that is digitalis toxicity, ischemia, reperfusion. So you know that digitalis dioxin, which is a sodium potassium ATPase inhibitor, which is called as a positive inotropic agent, because I will discuss few of the things that will be useful for the GPAT also. So the digitalis dioxin, which is a sodium potassium ATPase inhibitor, what it increase the calcium dependent contraction. नो इट मीन्स अगर आपका डिजिटलिस कैल्शियम डिपेंडेंट कंट्रैक्शन करता है तो कैल्शियम का ओवरलोड बढ़ेगा, जिससे क्या होता है, अरिथमिया प्रोसीड होता है. दैट्स वाई whenever you will give a digoxin at a higher dose to the patient for a first time, the chances of the arrhythmia are more, because it is a pro-rhythmic agent at a higher dose. So that's why these are the two phenomena, which is called as a early after depolarization, another is called as a delayed after depolarization. The next thing is called as a re-entry phenomena, because you know that our heart, it is a four chamber, I have discussed with you, and you always remember that all humans, that they are four chambered, except some animals like fish, frog. Fish is having a two chamber heart, and frog is having a three chambered heart. So now this is your heart, this is a four chamber, this is auricles, left auricle, right auricle, left ventricle, right ventricle. Now from SA node, the impulse move toward AV node. So this is AV node, this is SA node, and from AV node toward the bundle of his. Now suppose if there is any problem here or here in the myocardium, suppose patient was suffered from heart attack, किसी को हार्ट अटैक था जहाँ वहाँ पे ब्लड सप्लाई कम था, जिसको हम कहते हैं इस्कीमिया. सो इस्कीमिया पहले होता है, इस्कीमिया रीपरफ्यूजन इंजरी बाद में होता है. सो वेन एवर यू नो दैट there is a blockage of blood supply, this is called as ischemia. Now second time, the heart will increase the pumping. So with the pumping the pressure will be high. जब वहाँ पे प्रेशर बढ़ेगा तो प्रेशर एक्सर्ट होगा एक एरिया पे जिस पे रीपरफ्यूज होगा, and then there is a injury. Now in this case, suppose if this was the damaged area due to heart attack or due to myocardial infarction, the nerve will not be moved further, so it will come back and it can move toward this side, because previously this conduction was already initiated, and again this wave of contraction moved toward this side. This is called as a re-entry phenomena. So that means re-entry of the impulse toward any area, and it is blocked by the damaged part of the heart. So this is re-entry, which is also, you know that in case of all Parkinson White syndrome is the major phenomena. No, this is, you know that refractory tissue. No, this is the tissue, you know that where is a complete damage, and this is the tissue where there is a partial damage. Now in case of partial, impulse conduction will be slowed down, but in case of, you know that damaged tissue, the impulse will totally be blocked, and it can re-enter to any phase and initiate the another, you know that again contraction of that particular part. Now this is called as a re-entry or functional re-entry phenomena. Now this re-entry has been shown by this way, you know that in case of normal heart contraction, your conduction potential will be like this, but in case of re-entry, there is a early after depolarization. No, this is the ECG, the ECG will show this type of the waves. So that's why this is more critical, as well as that it is an emergency situation which is need to be having some kind of drug therapy or emergency treatment should be there. Now, this is a type of cardiac arrhythmia. So, how many type of cardiac arrhythmia I will discuss with you? Extra systoles. So, what is extra systole? Whenever there is a premature ectopic beat due to abnormal automaticity. Now, this extra systole means contraction. So, why there is a extra contraction? This is due to the overactivity of the SA node or toward the AV node. So, this is also called as ectopic extrasystole. Next is proximal supraventricular tachycardia. Now, in this case, the heart rate will be around 150 to 200 per minute. You know that there is a increased demand of oxygen, and this is also emergency situation where there is a 1:1 auriculoventricular contraction. So, ratio of this auricular contraction is 1:1. Ratio is equal, but heart rate is increased. This is a condition of proximal supraventricular tachycardia. That is, proximal means the upper part of the ventricles, supraventricular tachycardia. So this is also associated with the excessive sympathetic system activity, that is increase in the adrenaline or some other sympathetic amine levels. So this is the another condition which is called as arterial flutter. So in this case, arterial flutter, you know that there is a heart rate which is approximate 200 to 350 per minute. Again, this is a emergency condition where there is a need of immediate treatment, where the physiological ratio is 2:1 or a 4:1. So basically, it means whenever the conduction is also abnormal, that is auricle conduction is not equal to ventricular conduction. So this could be also a condition where there is a hypoxia and hypoxia dependent increase injury in the myocardium. Now, arterial fibrillation, this is the condition where the heart rate will be around 350 to 550 per minute, and in this case, what will happen? This can be again due to the abnormal automaticity of the heart, and this can be due to the any you could know that myocardial infarction associated problem, or it can be due to the excessive sympathetic tone, increase intake of that nicotine, excessive smoking, such type of condition. So this is also a emergency condition. Next is a ventricular tachycardia. This is the condition where the ventricles show a high rate of contraction. This is this is due to that ectopic focus and after depolarization. So this ectopic focus means whenever the SA node will generate more impulses toward AV node, and AV node increase the ventricular contraction and responsible for the ventricular tachycardia. You know that another is a torsade D point. I have discussed with you what is torsade D point. The torsade D point is the condition of early after depolarization, whenever the heart will not go for the relaxation. And in this case, so what will happen? In this case, early after depolarization, this phase of that QT interval, this phase will be slowed down, and in many cases that this T wave will not be appear in case of torsade D point. So this is a early after depolarization conditions. Next is called as a ventricular fibrillation, whenever the ventricular show high contraction, and auriculoventricular block. So this is the last condition where that after auriculoventricular fibrillation, there is a reduced oxygen supply, and then there is a that blockage of any particular part. This is due to this ischemia, and mostly due to excessive vagal reflux. So increase activity of acetylcholine. So this is the thing, you know, that there are three type of the auriculoventricular blockage, that is first degree, second degree and third degree. Now here you can see what is the first degree. So basically you know that whenever you will see on the ECG, the wave will be appear like this. So whenever there is any missing of any part of the wave, you know that any particular wave is missing, like suppose T wave for the first interval, for the, you know, for the once is missing here, then you know that this is considered to be a first degree AV block. Next is called as second degree. Whenever you know that there is a increase, you know that is the progressive prolongation of PR interval. So when your PR interval is prolonged, so that is delayed type of condition. In this case, whenever the SA node slowly generate impulse toward the AV node, then this condition is called as a second degree block. And the third degree block, you know that whenever there is a number of time the missing of the waves, like the P wave which is fixed at the PR interval, and sometime there is a non-conducted P wave is appeared. So this is called as a third degree, which is a complex condition. So in this case there is a complete heart block. So in this case you know that this peak of R wave will not completely be appeared like this. So this wave will be like this. So slowly slow down, and this is the condition of the first, second and third degree auriculoventricular block. So now this is the torset D point on the, this is a normal ECG you are looking here. This is torset D point, that is the shifting of the wave toward the downside, that is the hyperpolarization phase. This is a ventricular tachycardia. You know that the waves which will be appear like a bioassay, तो आपको ऐसी waves दिखाई देंगी. This is a ventricular fibrillation. So where the, you know that the PQ R, the R wave peak length will be reduced, and this is the phase of phase 2 early after depolarization, phase 3 and delayed after depolarization. So these are the things which I have discussed with you, that what are the cause of arrhythmia and how arrhythmia will be happen, and how you will do the analysis of this type of the thing, कि कैसे आपको पता चले कि ये ventricular tachycardia, because the ECG strips examples has been given. And in the next lecture these are a few basic questions you can be used for your exam, or they are very useful for the preparation. And hope this lecture was very useful for you all. And in the next lecture I will discuss with you what are the different type of drugs which are used to treat the arrhythmia. So you like, watch and subscribe SSB Pharma Learning channel. You are welcome. Thank you very much.